The Spiegel and Tice tubevent balloon dilatation system is intended to dilate the cartilaginous part of the eustachian tube to treat persistent obstructive eustachian tube dysfunction.
Good day, ladies and gentlemen. My name is Matthias Tisch. I am ENT professor and head of the ENT department of the military hospital in Ulm, southern part of Germany. I want to give you an overview about tuboplasty in children as well as in adults. The patient in the theater is a 74-year-old female with cholesteatoma recurrency on the left, long-standing ventilation disorder of the left ear. Now renew tympanoplasty with tuboplasty for cholesteatoma recurrency. So let's go to the theater.
Here we have a typical arrangement of the materials needed for the operational procedure. The inflation device with an extension tube. A bowel filled with sterile isotonic saline solution NaCl 0.9% and/or contrast medium. In his case, we used a tubevent short balloon catheter. The tuboinsert insertion device. Arrogid endoscope usually with a 30 or 45 degrees angle. Antifog solution for the endoscope. Anacell suction tube. Various sizes of nasal specula. Dressing forceps for inserting swaps or patties, drenched saturated in a decongestant medication solution. Now it is time to prepare the inflation device. To fill the pump with sterile isotonic saline solution, the assistant or the surgeon moves the lever from the middle locked position to the left unlocked position. The assistant or the surgeon holds the tip of the tube in the bowl with saline solution. Now the assistant who is holding the inflation device pulls the plunger in order to fill the inflation device. After this, the 50-centimeter extension tube can be securely connected if required. By pushing the plunger of the inflation device, air inside of the syringe and tube is being flushed out of the system. The lever is then moved back to the center position to lock the inflation device. Remaining air in the system now will be removed by turning the knob clockwise. Now, the inflation device is ready to be connected to the Luer lock of the tubevent short balloon catheter. After the catheter has been securely connected to the inflation device, remove the transport protection tube. When doing this, make sure to also remove the rubber sleeve from blue catheter hub. Finally, remove the mandrel and the balloon sleeve from the catheter. Carefully insert the catheter into the insertion device. Make sure the olive of the catheter does not stick out of the tip of the insertion device. The next step is the endoscopic visualization of the eustachian tube orifice. When performing the contralateral access, the endoscope with either a 30 degrees or 45 degrees angle enters the opposite side of the nose to be treated. To avoid bleeding, ensure not to scratch the mucosa when inserting the endoscope. Hold the endoscope in position when the pharyngeal orifice is identified. Avoid inserting the tubevent short balloon catheter into the fossa Rosemuller. The next step is the positioning of the tuboinsert insertion device, which enters the nose at the side to be treated. Step 2. Positioning of the tuboinsert 45 degrees proximal to the ET orifice. Once the insertion device is in place, make sure the olive tip of the insertion device does not enter the tuba ostium. The assistant then takes control of the endoscope. Step 3. Successful placing of the tubevent in the cartilaginous part of the ET. With the surgeon's free hand, the tubevent short balloon dilatation catheter can now carefully be pushed into the cartilaginous part of the eustachian tube. Avoid pushing against unknown or hard resistance. This could cause tissue trauma or device damage. In case of a high amount of resistance, pull back the catheter into the insertion device and readjust the angle and position of the tip before you continue with the procedure. Keep in mind that thick mucus may also cause a certain amount of resistance. The surgeon must handle this procedure carefully so that the surgeon can receive the haptic feedback for the safe positioning of the catheter. Once the balloon has been placed correctly, the endoscope is handed over to the surgeon so that the assistant can operate the inflation device. The assistant turns the knob, the plunger clockwise to apply the required pressure of 10 bar. Step 4. Inflation time. Hold the pressure value for 2 minutes. If the applied pressure drops during inflation, Manually readjust the pressure to 10 bar. Step 5. Deflation of balloon and removal of the tuba insert with the tube vent. After 2 minutes, reduce the pressure completely by turning the plunger of the inflation device counterclockwise and lock the device by switching the lever into the center position. The removal of the catheter should be done under endoscopic supervision. The catheter and insertion device should be withdrawn together, ensuring that the balloon remains outside of the insertion device. In addition to the contralateral access, the eustachian tube can also be accessed via the ipsilateral or pharyngeal path.